Welcome. Hello, everyone. Thanks for joining us. Today we are joined by Denver Mayor Michael Hancock, Senate President Leroy Garcia, Speaker-designate Alec Garnett. Earlier today, I also spoke with House and Senate Republican leadership. An update on where we are: 4,331 new cases today. At this moment in time, 1,378 Coloradans are currently hospitalized. So this is very, very real in our hospitals. Most will make it out, some won't. And in fact, we have lost 2,299 Coloradans due to COVID. I attended my first funeral for a friend that I lost due to COVID this last weekend, socially distanced and much smaller than it would have been. But I know that many have suffered loss. Brothers and sisters, mothers and fathers, aunts and uncles, and we now continue to see our state on this exponential growth curve that we must stop to save lives and avoid overflowing our hospitals. Last week, over the span of 3 days, just to show how fast this virus can grow, we went from 3,500 cases a day to 5,100 to over 6,000. The 4,300 today is usually, we typically have lower early in the week because of less tests on the weekend that are processed. But this growth keeps skyrocketing. We now have over 1,300 patients hospitalized. That's more than we've ever had before. So remember how bad it was in March and April. There are more Coloradans hospitalized today from COVID than in March and April. Our hospitals are starting to get stressed now. They've had time in the last 6 months. They've built capacity. We're not at capacity. We're in a much better place than we were in March and April, but this trend cannot continue of the increases that we've seen in the last few weeks. If we know anything about this virus, and we've seen it play out elsewhere in much of our country, we're seeing it play out here, it enters these periods of exponential growth. And for decades in the future, scientists will study why it goes to these exponential growth patterns. But right now, in the here and now, we in Colorado need to act to stop this exponential growth, to save lives and save our economy. We know that, for example, Parkview Hospital in Pueblo reached more than 100% capacity yesterday. 100 COVID patients. And multiple patients were transferred to other facilities. There is room for them still, but with the experience of Parkview that more and more hospitals are facing, there's only so many beds in the system for both ICU and non-ICU, and we've worked mightily to expand it. We also have some alternative care sites, and we have the ability to do additional work around suspending elective surgeries, but our hospital system is in a period of significant stress right now. And our promise to the people of Colorado is we want to make sure that whether you have COVID or some other condition, there is treatment and a bed for you, right? If you have a heart attack, if you have a stroke, if you have cancer, if you have appendicitis, if you have COVID, if you have pneumonia, we want to make sure that you can get access to the doctor, the nurse, the hospital bed, the care that you need to get better. That's very important. As I shared last week, we're starting to take efforts to surge the hospital capacity. They've been underway for some time. These trends that we're worrying about in many parts of our state are exponential, and we've seen this happen across our country. It's happening in the upper Midwest now. We're just a few steps behind that here in Colorado. And it's a problem everywhere in our state. In Adams County, 1 in 58 people currently contagious with coronavirus. In Denver, 1 out of 64. Contagious with coronavirus. In Arapahoe County, 1 out of 83. Statewide, about 1 in 110 people are contagious with coronavirus. And I know that many Coloradans, most Coloradans, are doing our part. People are wearing masks. People are staying home when they can. They're avoiding interacting with others. But the truth is, seeing this exponential growth that we are experiencing, we clearly need a more drastic shift in behavior to further slow the transmission of the virus and prevent this exponential growth curve from simply overwhelming our ability to take care of people who are sick. So due to the grim news of the rapid increase in hospitalizations, we are taking action to prevent a catastrophic breach of health care. That means that several counties are going into red phase, which is a severe risk phase, which results in additional steps to make sure that they can recover and avoid any kind of stay-at-home or shutdown or lockdown. Really, for people across our state, we want to make it clear that there should not be gatherings between people of different households. You should really live and thrive with your bubble, with your family for the next few weeks in this dangerous period. That's the safest thing that you can do. For those counties that are entering the red phase, indoor dining is temporarily closed. Restaurants and coffee shops still offer takeout, delivery, outdoor dining. But even for the outdoor dining, it really should just be your household going out. It can be on a date with your significant other. It can be your family of 4, your family of 5, but not 8, 10 friends getting together from different households. That is how the virus spreads. And remember, just because indoor dining in some areas might be temporarily closed, it doesn't mean that restaurants are closed. In fact, they need our support and our patronage more than ever before. Takeout, delivery are great ways to enjoy your favorite neighborhood restaurant and help them get through this difficult period. And I encourage you to join me in supporting our restaurants during these challenging times by treating your family to takeout or delivery. And we look forward to working with the legislature to help our cherished neighborhood businesses get through this difficult time period. Bars remain closed in the red areas. Gyms can operate in a very limited capacity with social distancing, 10% capacity. They have to have that reservation system in place. It's good to be healthy, it's good to work out, but we don't want that to be a social environment where the virus will spread. And very importantly, at-risk populations should stay home whenever they can. That's what my parents do, and that's hard not seeing them. They're both in their 70s, but we want them to be here for many years to come. But if you are in your 70s or 80s or 90s, if you have a respiratory condition, if you're significantly obese or diabetic, you really should stay home whenever possible. Meaning you might go to the grocery store and come back, but it's just not the time to see friends or be out. This virus has a significantly higher hospitalization rate and fatality rate. Now, to put things in perspective, the biggest group of people hospitalized are people 40 to 64. This sends people to the hospital of all ages. But there is an even higher risk of hospitalization per person and a higher risk of death if you are hospitalized for people in their 70s and 80s. These are not easy steps to take. But given the rapidly escalating trend in cases and hospitalizations and tragically the significant increase in deaths that follows that and that we've seen again in the last few days, we must act now to save lives. We must act now to avoid a shutdown or lockdown. These changes are reflected in an update of the dial system and the forthcoming public health orders. We're working closely with our local school districts on how we can ensure our children continue getting more in-person education. For counties that fall under red or severe risk, childcare facilities remain open, and we encourage preschools through 5th grade students to continue learning in person or to restart if the districts have taken a hiatus. Middle school students can do in-person or hybrid or remote. And in the highest risk areas, high schools generally should be hybrid or remote. And higher education, it should be generally online with limited in-person. We know that that's needed, especially around some of the vocational courses. That should continue. But in particular, we want to make sure we emphasize the need for K-5 especially to return to in-person instruction. We feel that based on the data, for many families and for many kids, that is the safest place they can be with the safety parameters that we have at school. And we encourage that in-person service so that our children's future is not yet another casualty of this pandemic. We are working with CDE and CDPHE, the Higher Ed Department, Education Department, to really direct additional federal resources to help school districts safely return to in-person learning sooner rather than later. And that will include very soon, really in the next few days and weeks, including directing some additional funding for outdoor classrooms, for testing, for PPE, for supplies, whatever schools and districts need to be able to get back safely. We want to support that. I know all of these restrictions are very painful. It's a horrible choice. It's a horrible decision for anybody to have to make. County commissioners, mayors, governors. And we hope that this path will accomplish three things. One, prevent even more devastating or drastic steps, like a lockdown or a shutdown. Two, help our kids return to learning in person in the weeks and months ahead. And three, have the state step up. And that's why we're joined by legislative leadership to help our small businesses, our restaurants, our child care providers, our renters get through this tough and dangerous time. I am proud to be standing here with Mayor Hancock, who's been a strong partner on combating the spread of the virus, Speaker-elect Alec, Garnett, Senate President Garcia. Speaker-elect Garnett and Senator Garcia are joining me here to make sure Coloradans know that we're committed to ensuring that as we have to make these health measures that are necessary to reduce the exponential spread of the virus, it's important to pair those actions with real financial relief for small businesses, for hardworking Coloradans. Now, of course, nothing we're talking about today prevents any city or county from implementing additional local health measures, and some have, but the changes we're implementing are important for public health, and they're also important for us to get our economy going and return to economic normalcy and avoid the economic devastations of any kind of lockdown. Over the past few weeks, we've seen many leaders across our state calling for coordinated regional action. That's why I'm proud to announce today that state and local governments are acting together. And this week, counties in many parts of the state that are experiencing uncontrolled growth of the virus are moving to this phase in red with the health parameters that we just discussed. Of course, I want to be clear that across our state, the virus is prevalent, and you should avoid interacting with people outside of your household, regardless of what is being done on the policy side in your city, your county, or the state. And while difficult, it's really necessary for counties with sustained and uncontrollable viral growth to take this step to control the rapid spread of the disease, to save lives, to avoid breaching hospital capacity, and to enable them to move forward with opening their economies. In some cases, like in the Front Range, the Northeast, some mountain communities, counties are moving together as a region to save lives. Our Department of Public Health is working closely with counties right now, and over the next few days we'll share regular updates of what's taking effect and where. I expect a number of counties to be moving in the immediate term. This is a tool for mayors and commissioners and the state to work in tandem where needed to minimize disruptions to the economy and to break the exponential growth curve, which simply doesn't break itself. I just want to be clear. We've seen this play out in areas that have been harder hit. Absent intervention, it just keeps getting worse. Keeps getting worse. And that's what we want to avoid. It's my greatest hope and informed belief that these swift and bold actions will do what we need them to do. Prevent the need for further restrictions to avoid overwhelming our hospitals, get kids back to school in the next few days, weeks, and months, and help Colorado get through this difficult period to bridge until the vaccine is widely available. Such promising news, over 94% Moderna vaccine, over 90% Pfizer vaccine, first doses in December, healthcare workers, significant dosage for Coloradans early next year. We're getting there. We're getting there. We just need to get through these difficult few weeks to make sure that we can break this exponential growth curve that has currently forced 1,300 Coloradans into the hospital and will cost us many more lives in the days and weeks ahead. I'm proud to turn it over to Mayor Hancock, an important partner in Denver, to talk about what this means for Denver, how they're working to implement these measures, and how we can work together to get through this difficult period. Mayor Hancock.
Governor Polis, and to our legislature leadership, Speaker, and Mr. President, for several weeks now, and this has been happening across our country, not just in Denver, in Colorado, cases of COVID have been on an exponential rise. Our country is setting a record for new daily cases and hospitalizations. seemingly every day now for the past several days. We're seeing similar trend here in Denver. Our average daily cases rates remain extremely high, especially among young adults, which increases the risk of spreading it to more vulnerable populations. Hospitalizations in the region are the highest they've ever been. What makes this different from March and April, as I've been asked quite a bit from the media, is that we now know more about this virus than we knew back then. We know more about the treatment and the steps to take to appropriately remove the opportunity for this virus to spread from person to person. Our hospitals have had time to prepare, but unlike in March and April, staffing is now a challenge after several months of sustained community spread and the sheer amount of cases we're experiencing today. Doctors, nurses, and hospital staff are once again carrying us on their shoulders, and we as individuals must step up to lessen the burden on them and everyone else. This situation isn't irreversible. Without a coordinated national response, the responsibility remains with the states to take appropriate action to get this back under control. And as you've seen here today with Colorado and states like Washington and Michigan over the weekend, that's the approach being taken. And I hope that other states join all of us in these steps as well. This is a balancing act to maintain our focus on public health protections against COVID without further compounding the additional public health impacts of the economic stress on our families and local businesses. And let me simply say, along with the actions that states are taking, it would be incredibly important for the federal government to take the step to bridge the American people from this moment to the time that we are inoculated with the vaccine. And this is a balanced step that's necessary for all of us to take. I want to thank Governor Polis and CDPHE for listening to our input on the new public health measures being announced today. This is going to be tough on a lot of folks. I know that, and as Governor Polis just mentioned, he understands that as well. That's why we did provide nearly $10 million in emergency relief to 1,760 small businesses in Denver, with a priority put on small businesses existing in our most vulnerable neighborhoods, and set up programs like temporary outdoor dining program, along with grant funding to help cover the costs of these spaces, which we estimated preserved some $287 million in estimated revenue for Denver restaurants. But if we're going to reverse the trend, we must move now with additional measures before more drastic steps have to be taken. And I'm calling on Denver and the metro region to step up like we've done before, to push back mightily on this virus and get back under control. The blunt force response of another stay-at-home order can be avoided if we take the simple but necessary actions to limit the chance for exposure to the virus. So we simply must do it. Stay at home as much as possible, put those social gatherings on hold for the time being, including extra care for Thanksgiving. And as the governor mentioned, and has asked several times now, please work from home if you have the ability. And to our business owners, please let your employees work from home if you're able to. Wear a mask when and where required to wear it. Finally, we're celebrating the good news of the possibility of a vaccine, as the governor mentioned, in the coming months. But we're not there yet, and that isn't a license for us to let up. We got to buckle down and do what we have to do what we need to do, so that ultimately, once again, in very short order, we'll be able to do what we want to do. Thank you again, Governor.
Now, look, we all know this isn't easy for Coloradans. It's not easy for those who are worried about their health. It's also not easy for those who are worried about their paycheck. And Really, none of us are going to get through this pandemic unscathed, whether it's the health of a friend or loved one or yourself, or whether it's your pocketbook. Everybody is facing very real challenges. In the spring, many Coloradans were buoyed up by Republicans and Democrats working together in Washington to support one-time payments on unemployment benefits, direct support for everybody. But unfortunately, even as cases have exploded across the country, Congress and the President have not yet passed much-needed relief for people. Here in Colorado, we want to do the best with what we have to take care of our own. And we're going to continue doing everything we can to support those who are the hardest hit. That's why a few weeks ago, I took action in consultation with legislative leaders to provide a direct, one-time $375 payment to over 400,000 Coloradans who faced unemployment during the pandemic. And folks will get that in the next couple of weeks. But there's more that we need to do together to shore up our economy and prepare ourselves for a strong economic recovery. That's why, in addition to these public health measures, I'm calling the legislature into a special session to provide immediate relief for the economic and financial hardships that many Coloradans and small businesses are facing. Extraordinary times call for extraordinary actions. I'll be asking the General Assembly to take up critical legislation that will help Colorado families and Colorado small businesses survive these challenging winter months ahead to bridge us to the vaccine. I want to thank Senate President Garcia, Speaker-designate Alec Garnett, Speaker Becker, and other members of leadership and the Joint Budget Committee for their partnership and commitment to doing what we can as the state of Colorado to help our fellow Coloradans in their time of need. We're still developing the specific parameters for the special session. We expect to have that by the end of the week, but it will include the following items: a small business relief package for those businesses that have been most impacted by capacity limits like restaurants and bars, with direct aid and tax relief to help them get through the winter months. Housing and rental assistance for those who are struggling to make ends meet and to avoid an eviction and foreclosure crisis. Support for child care providers to help them stay open, to ensure that parents are able to earn a paycheck and work, particularly with even when schools are in, often having to quarantine and go out for 2 weeks when a particular class has a case or two. And expanding broadband access for students and educators to ensure that students can learn online with hotspots and access when a school is in remote learning. We will be releasing a call in the coming days when we have a better sense with our legislative partners, Republican and Democrat, about the best way to time and sequence the short session. We are also sending another letter to the federal government, along with local governments, urging Congress to act on another stimulus package to provide help for our fellow Coloradans. And while the measures that will be discussed in the special session are urgent and necessary right now, our state needs substantially more help from the federal government to continue to respond and recover from this pandemic and implement the vaccination plan. I am honored to turn it over to Senate President Leroy Garcia to talk more about this special session.
Good afternoon. As we are aware, this epidemic has torn through our country with unmatched aggression and unrelenting persistence. It has sadly claimed the lives of more than 247,000 Americans and has left many families ripped apart. Yet the loss of life is only one piece of this devastation. Countless Coloradans have lost their jobs, their life savings, their family businesses, and not least of all, their hope. Congressional inaction and partisan bickering has left millions stranded and completely abandoned at a time where there is the greatest need. Heads in their hands, people all over this state are staring at the unpaid bills that they have on the kitchen table, wondering how in the world are they going to make it through the end of the month, let alone through the rest of the holiday season. And this uncertainty and lack of reliable support has caused an immeasurable amount of pain and suffering. Families are on the edge of homelessness. Parents are anxious, struggling with their working from home without childcare, the absence of dependable broadband, and many rural students are watching their education dry up right in front of them. These Coloradans cannot wait another moment, and neither should we. We need to urgently bring relief to the people of our state. So we have decided to roll up our sleeves, pulling every lever, finding every dime, and using every tool within our toolbox to make this happen. And I'm proud of the fact that we have been able to collaborate as state leaders, in addition with our membership. I'm thankful for the governor in bringing this executive action to that would allow us to alleviate the burdens of struggling Coloradans without delay. Governor, know that the Colorado Senate stands ready to answer the call and do the people's work.
You, Senator Garcia, I'm proud to work together to provide relief to hardworking Coloradans who wonder, many Coloradans wonder how they're going to pay rent next month or put food on the table. And we in Colorado will step up to do what we can, and I'll turn it over to Speaker-designate Garnett.
Thank you, Governor, for your leadership and collaboration, for pulling us all together today, and for your leadership through these very challenging times for the state of Colorado. Thanks to Mayor Hancock for leading not only on a regional basis, but the city and county of Denver, and thank you, Senate President Garcia, for your leadership together as we tried to navigate these very troubling waters that are ahead in Colorado. As we've waited for the federal government to act to provide relief to Coloradans in every corner of this state, the calls for someone to step up and help have grown and grown and grown. Small businesses are calling me on a daily basis asking, what are we going to do to help them bridge the dark time between now and when a vaccine is available across the state. I've had people throughout my district say that they're not going to be able to meet their rent in the upcoming month, and what are we going to do to help them out? As we've waited for the federal government to act, we have been working in a collaborative way to think through what we can do as a state to provide that relief to help Coloradans. It's clear to me that these three buckets, helping small businesses, helping people who are feeling housing insecurity, and helping child care facilities remain open, are three of the most critical things that we can do as Coloradans to help bridge us to the light at the end of the tunnel. Our state's recovery could hinge on the next few months, and targeting relief now to those small businesses and those hardworking families will have the greatest multiplying effect through our local economies, lifting up those who have been most impacted by this virus. Many people are going to ask, why now? Why not wait until legislative session starts in January? And frankly, January will be too late for too many small businesses, restaurants, bars, and too many Coloradans that are on the brink of eviction and foreclosure. We just can't wait any longer for Congress to act. We must come together in a collaborative way and make sure we move forward to do everything we can for Coloradans. Many will ask, where is this money going to come from? You passed one of the most challenging budgets in state history just a few months ago. Because of those tough choices that legislators made, along with the Joint Budget Committee, to pass a conservative budget, we were able to see revenues come in as our economy has held on through the last few months. And there is one-time money that we can use to help stimulate the economy and help those families out. This is what Coloradans across the state expect from their legislative leaders. This is what they expect from the people that they have voted for to go to the state capitol and represent them. I look forward to working in a collaborative way with the executive branch and across the aisle with Republicans to make sure we're doing everything we can to support Coloradans in this very challenging time. Thank you, Governor, for all your work, and I look forward to getting into the building and getting to work to help Coloradans.
Thank you, Speaker-designate Garnett. We have heard very encouraging news about the vaccine over the last few days and weeks, but until it is administered to folks and they build that immunity, it remains a guiding light and inspiration to us to buckle down now and avoid interacting with others outside of our households. The chances of contracting the virus across the entire country are higher today than they were at any point in the pandemic. And we all should be cautious and careful in our lives, not fearful, not anxiety, but justified caution. And what we do these next few weeks will determine how many more Coloradans are hospitalized, how many more lose their lives, and how we can strongly position ourselves for building back stronger. You know, you've heard me say it a number of times, and we'll keep offering the very best advice that we can, but there's three things that I want to ask everybody to do. One is wear a mask when you're around others. The second is avoid social interactions with people outside your household to the extent you can. And three is physically distance yourself when you do have to have those limited interactions with others. Try to stay at least 6-8 feet away, and of course wear your mask. It's not an easy thing to ask, but certainly better than the alternative of being hospitalized with the risk of loss of life with further setbacks. I'm encouraging people to make a safe choice this holiday season. Safest thing that we can do is celebrate with our own household, incorporate others virtually. There's some that are already quarantining so that they can have a safer Thanksgiving with others, but it is now too late to begin that quarantine for yourself for Thanksgiving. You really would have needed to start that a few days ago, and I know that folks are doing that. But my family is just having Thanksgiving with my partner and our kids. We, as much as we'd love to see my brother and sister and Marlon's sister and dad and my parents as we normally do, it's even more important to us to make sure that they're there for many years to come. And I know that that's the case for your family as well. So let's do this, Colorado. We've been in this together from the beginning. We've done this before. We've succeeded in reducing the exponential outbreak that we faced at the beginning of July. This one's far worse, but we need to reach deep in that reservoir of willpower that we have and show the resolve to simply avoid socializing with others, to wear a mask, to be careful and cautious, to help make sure that we can save lives and get our economy going. Thank you. We're happy to open it up to questions.
You mentioned red, but you haven't said which counties are going to red, so I have a question after that, but I need to know which counties first so I can direct the follow-up.
Yeah, it's being done in partnership with mayors and commissioners in several counties. I think the estimate is that 10 to 15 counties are going to be moving that direction in the next few days. I'll let the mayor speak to that.
Question, yes, we expect to be there. That's one reason why we've been in regular conversation with the state, with the governor's office, discussing Denver's status and making sure that we have alternatives compared to the last dial. What's in the middle? How can we create a balance here?
So this goes to either of you, because you're both parents. It feels like by creating this new purple color on top of red, you're counting to 3, but not wanting to quite get to 3, like 1, 2, 2.5. We're serious now. Why the creation of something new?
Yeah, Marshall, great question. I think it's clear from the data that what we have been doing hasn't worked well enough. The mayor has tried mightily with really strong mitigation measures in Denver, so have other counties. We had hoped that it would have worked, but it hasn't. And so it's time to take additional measures that data shows from other countries, other parts of our country, will have an impact, will set that trend, will help avoid measures that would be even more devastating from a psychological and economic perspective. And so we have great confidence that this path will succeed. It's not a given. The hardest part is on the people of Colorado. I mean, the hardest part is how well we avoid interacting with others outside of our household. It's not the easiest thing to do. It's also not the hardest thing to do. And we are asking people to act in your own self-interest of protecting your own family. And for many people, that means, canceling kids' play dates or kids' birthday parties. For others, it means canceling Sunday brunch groups. And just waiting until this is a little bit safer so that you don't bring a unwelcome guest that could threaten the lives and cost the lives of some of your friends and loved ones.
Hi, this is Tara Mason from the Sentinel. I'm wondering what your communication is like with either the Trump administration or the Biden transition team at this point. And then for leadership, I'm curious, it sounds like, hospital staffing is an issue at this point, and if there's anything in this legislative session that may help address that.
So this direction with RED is consistent with the guidance that we have from the COVID task force in the Trump administration. They send weekly updates. I met with Dr. Birx 2 weeks ago. We have updates 2 or 3 times a week with regard to the type of actions that are needed. And just as we've noticed in our state and many parts of the country, the COVID task force nationally has stated the obvious in saying what we're doing isn't working, and we clearly need to take more mitigation measures, and that's what we're doing today in a data-driven way. The staffing surge is already underway. While we would certainly be open to it, we've not identified anything that would require a legal change to facilitate that. We activated additional staffing contracts. We're working with the hospitals. We have the alternative care centers that, if they need to, can come online. And if there are other ways that we can work both with the agencies of the state government or with the legislature to improve staffing in the short term, we look forward to exploring those.
Hello, Governor. This is Vinny Valjudas at Bloomberg News in Denver. Pushing a little further on the White House question, have you or your team been in touch with Joe Biden's COVID team, and what sort of aid is being requested and given? Again, looking ahead to January and the Biden administration. Thank you very much.
I have not. No. President Trump is president, and we work with the White House. I was on a White House call yesterday. I'll look forward to working with the next president, but I've not been in touch with the president-elect's COVID task force.
Governor, is there a reluctance to announce the counties simply because perhaps some of the counties aren't buying into where you would like to see them?
Well, we would like them to avoid shutdowns and lockdowns. I think there are some counties that we're considering that. We hope that by showing them a path that avoids lockdowns, we can keep the economy more open. I would be surprised if any went to lockdown in the next week. It wouldn't be outside the realm of possibility, but I'm hopeful that the path today will encourage folks to stay open and to stop the exponential rise of the virus.
What's the criteria to reach this higher level of restrictions, and which counties qualify? Let's if you want to talk about kind of, this is a little bit more technical, but kind of how the red and the purple work. There were 3 things that we looked at for red. One is cases per 100,000. The second was positivity rate, which included how much testing is being doing. And the third is, are your hospitals at capacity? What essentially we're now is bifurcating that, and we're saying that cases per 100,000 and positivity are kind of the red, and the purple, or the most severe stage, is literally your hospitals are being overwhelmed. That's when you no longer can provide, you're right at that point where if you have a heart attack or stroke or COVID, you're not getting the care that you deserve to get better. No counties are currently in purple or in that condition, but if what we're doing now doesn't work, that would be what counties would look at if they are actively overwhelming their hospitals. We want to avoid unnecessary loss of life. We've been clear from the beginning. We're not going to eradicate the virus from Colorado. We set that expectation early. We expect it to be here. Frankly, if there's 1,000 or 1,200 people hospitalized, that is within the capacity of Colorado to administer care. But the exponential increase means that the writing on the wall shows great difficulties ahead unless we step up and do better by avoiding socializing with other households, wearing a mask when we're around others, and maintaining social distancing.
Hi, Governor. John Daly, Colorado Public Radio. Question for you about the dial. Do you anticipate that some members of the public might be confused by the changes in the dial? And would you anticipate adding any other levels in the future? Or is this the dial that will be looking at for the extended future?
The dial is a powerful tool for mayors and commissioners, but for the general public, we really want to keep this simple. There is a risk everywhere in our entire state. You shouldn't be really, whether it's 1 in 60 in your area or 1 in 120, this is the riskiest time for the virus everywhere in Colorado that we have had from the very start. So no matter where you live, you should avoid interacting to the extent possible with people outside your household. You should wear a mask around others more than you ever have before. And you should have social distancing, wash your hands when you get back if you do have to go out. Now is that crunch time. So I don't want everyday Coloradans to think about red and blue and green. I want you to think about you keeping your family safe. This is a tool behind the scenes to work with commissioners, to work with mayors. It's a very important one that's data-driven, that is a good way to prevent lockdowns and keep people safe. But for everyday Coloradans, let's just focus on what we need to do to get through this. And the biggest single thing is avoiding interacting, especially indoors, especially in close vicinity with people outside your household.
Hello, Governor. Gobernador, ante el aumento de los casos de COVID-19 en el estado, ¿cuáles son las medidas que anuncia hoy para controlar la propagación del virus?
Yeah.
Y ya que algunos condados van a irse a rojo, ¿tiene pensado ordenar quedarse en casa?
Muy pronto en algunas partes de nuestro estado es necesario cerrar la oportunidad para cenar de un restaurante. Todos los restaurantes todavía puede ser abierto para comida de ir y para mesas afuera, pero la situación es lo más peligroso que la empieza de la pandemia. Es muy importante ahora para personas no conversar y pasar tiempo con personas que no viven entre su propio techo.
First of all, what we've heard from state budget officials is that the range of money we're looking at for the special session is $200 million plus-ish. First of all, can you confirm if that is the range you're looking at? And then secondly, that's not a ton of money in the grand scheme, so can you set expectations for us about what can get done with that money and then also what can't get done?
And I'll defer to the legislative leaders in a moment. I can confirm that that's the range that's being discussed in that 200 million plus range. This is, again, the one-time, as Speaker-designate Garnett said, it's the one-time carryover funds that are accounted for in the budget under both legislative and executive forecasts. The funds are there. And that's correct. We cannot possibly do what the federal government can do. We can't do an economy-wide PPP program. We can't do a $1,200 assistance to every Coloradan. We can't do a weekly UI plus up. But none of that is an excuse for us not to do what we can to ease the pain and difficulty of small businesses and the people of Colorado, and I'll turn it over to our legislative leaders.
Just quickly echo that I think the governor is absolutely right. We have tools at our disposal, and I think for us not to be willing to convene or to do the work that is so desperately needed. I do know that several of our members from the Joint Budget Committee and members just in general are looking a little bit more pass at 200. So we'll be optimistic and see where we land.
The only other thing I would add is that the buckets we're looking at are very targeted, much different than what you've seen on the federal level that is more widespread and economy-wide, like the governor said. So we know that it's not the same amount, but I do think that it's going to make a big difference because we're looking at those who have been most negatively impacted by this virus, by the economic consequences of this virus.
Given that perhaps a quarter of the state is going to be going into red, what kind of impact do you anticipate that having on state revenues? Maybe not for the stimulus, but for the following year's budget.
Well, we have to look at what this is. The value of avoiding a lockdown or a shutdown is, of course, important for the state budget, but even more importantly, it's for families putting food on the table who were really, frankly, in many cases, only able to get through March and April because of the direct assistance of the federal government. And we simply don't have that capability in the state with the limited resources we have that we can target to help those who are put most at risk. What this simply means from a state perspective is, this is really, most things are able to stay open in some way. It's just really on the social gathering piece. There's not a large economic cost to avoiding social gatherings. It's really a psychological cost. It's a difficult thing for people of Colorado to do. Doesn't cost the state budget money, doesn't cost jobs for people not to hang out with friends. It's just hard. It's just hard on people who crave the human companionship of their friends and loved ones. And so that's the simple, most important thing that we need Coloradans to do in the weeks ahead.
Go to the phone for 2 in the back of the room.
Governor Charles Astry from the Grand Junction Daily Sentinel. A couple of things. First of all, a lot of things you're talking about doing, helping businesses and rent and broadband, much of this you're doing already. So I'm wondering what you really need the legislature for. And you also talked about tax credits for businesses to help them. That's only good when they do their taxes, which won't be until next year. So what can the legislature do that you can't do already?
Yeah, well, first of all, the legislature has fiscal authority. There is some that we have shared if it's CARES Act money, and some of that was custodial. There's no question that the legally cleanest way to do this direct aid is a special session. There might be parts of it that could be replicated through executive action, but it would be very difficult to replicate all of what is being contemplated through executive action. I don't believe anybody's talking about tax credits. What is being talked about on the restaurant side is the 2.9% sales tax they already collect that are normally custodial funds that are then paid to the state. They would be freely released and forgiven for use for rent or to pay employees. So it's money that's already collected in the normal line of business, not a different tax credit at a different time. The direct assistance would be prompt, meaning in the next couple months. We know the whole goal of this is to get through winter, which means this is cannot be designed as something that helps restaurants in March or June. It needs to help restaurants and bars now to pay their rent, hopefully keep their employees on board with the limited takeout and delivery business that they're able to do. So I think one theme that we agree on with legislative leaders is the mechanisms for all these need to be prompt and direct. There is not time for some different program to be set up, implemented in July of next year, nor is there time for one that would be passed through the normal legislative process beginning in January, normally not culminating in bills reaching me until February or March. So that's the reason for these extraordinary measures, is to find ways to get the assistance out to those who need it the most, small businesses and individuals, as quickly as possible.
And Charles, I think that's a really good question, and I just wanted to thank the governor's office for their collaboration with legislative leadership. I also just want to point out that this is different than some of the other actions that were taken before, primarily due to the fact that we're talking about general fund revenue that the General Assembly has direct oversight of, and so I'm sure I speak for all of our members in the Joint Budget Committee where when I say special session makes the most sense to come in and tackle these problems in a collaborative way with the executive branch. And it's an important distinction. And again, thank the governor and his staff for the amount of work that's been put into this. And I do think this is the appropriate direction to go when tackling these three particular buckets.
Hi, this is Erin Prater with the Gazettes in Colorado Politics. My question is, if purple is now the new stay-at-home order and red is no longer a stay-at-home order, how different is red actually from like a lockdown light like we've seen in Germany? Thank you.
Well, you'd have to, I don't know exactly what Germany's doing this week. I saw that recently Sweden and a number of other countries have limited capacity and closed down large social venues. We all share the goal of avoiding a lockdown where people can't go to work. In this scenario that we are now in, folks are able to be productive and work. They can earn a paycheck. The most significant part of the workforce affected are that in some of the restaurants and gyms that are affected, they're certainly not closed, they're open, but they might very well have difficulties in this environment. So we want to give them direct data. I also want to encourage Coloradans to support their local restaurants. Order takeout, order delivery. You know, with your household, you can eat outdoors if they offer it. We want to help our cherished neighborhood institutions get through this. I think, you know, restaurants are important not just because of the jobs for hourly workers that they provide and entry-level jobs. They're also mainstays of our downtowns and of our city streets, meaning that really they're an important part of that retail ecosystem. When we return to normal, when the pandemic ends, we want those vibrant destinations there so people are not just dining but shopping, enjoying, having an ice cream after dinner at an ice cream store or a cappuccino before. This is really what vibrant living looks like, and it's important that we can maintain that through this and avoid the economic and psychological costs of a lockdown like some areas have had to re-enter. As you indicated, I haven't looked at what Germany's done in the last few days, but there are areas that have reverted to that. We hope that that this will provide the needed change in trajectory here to avoid that kind of situation.
Looking at the changes now between level orange and level red, there's only 3 or 4 new restrictions that are being enacted. Back when you initially set up this dial, you and your health team felt like level red was so serious that counties at this level were in such bad shape you needed to shut everything down, and that was just something that we had to do, the price we had to pay. What has changed between now and then that makes it less safe or changes your mind about why we should be adding this new kind of changing the bar here?
We have reason to believe that this will work. We have more data on successful interventions in other areas. We know the high health and economic costs of lockdowns and want to avoid them. We also know that we have additional capacity in our hospital system in terms of ICU and non-ICU beds. And most importantly, if we didn't have cause to believe that this would work, then we wouldn't be taking this step. But we are confident that if Coloradans avoid social interactions, and some of these that are the focus of this are a proxy for social interactions. So there's nothing unsafe about these experiences per se of working out or dining. It's who you go with and what the social environment is like. So these are proxies. And, you know, can you go out to dinner with your family outdoors? It's reasonably safe. But it's that mixing. It's people from several different households going together. It doesn't matter whether it's in a private home or a restaurant or wherever it is. That is, I hope, what the people of Colorado are taking more seriously right now, because that is what the data shows would have the single biggest impact. Simply eliminating as a goal, but at least reducing significantly interactions with other households.
Minority Leader questioned why yesterday, even during the rumblings and rumors of a special session being started, why it's okay for 100 people from 100 different families to gather in the state capitol when it's not safe for families. So just I'm asking about the mixed messages, but then also for legislative leaders, given the fact that we're dealing with pandemic with, as Mayor Hancock said, lockdowns. How will you all ensure that the public's voice is heard when it comes to the special session?
And I'll defer to the legislative leaders on part of that, but I do want to applaud the decision to work together to come in does involve a certain courage on behalf of our public servants who will be putting themselves at some risk to be able to alleviate the needs of others. Now, that being said, they are making accommodations for their vulnerable members. I'll let the Speaker-designate and Senate President talk about some of those precautions, including social distancing and others. But I do want to applaud their courage in being willing to come together to do the people's work.
It's a great question, an important question, one that we have fortunately been able to learn from, especially because we were in session during this pandemic, and unlike other legislatures, when we look at the national data, some weren't convened. I think obviously our members' safety and well-being is at the utmost of our top priorities, but also ensuring that we're changing how we participate. And so, for example, you've seen us move and gravitate towards methods that traditionally didn't exist in the Senate or in the House or in committees, including remote testimony and those options. Obviously, transparency is really important for us. So that's the work that we have before us. I think we recognize that we have a responsibility. We take this oath to do what's in the best interest of our citizens, and so why you'll see us working hard to make sure that that's the practical way we move forward.
Governor Jason Gonzalez with Chalk Colorado. Many districts have gone remote, cited staffing challenges and a high number of quarantines. What's your reaction to those districts going remote, and what can the state do to address the challenges of staffing quarantines?
We are encouraging for those who are in any part of the dial that any Colorado county is at, that includes red and orange and green and yellow. We are encouraging in-person instruction for at least K-5, and we also encourage either hybrid or in-person for middle school. We know that high schools are a tougher call. Some are back and some aren't. There's a way to do it safely with the cohorting, but it's more challenging given the way that the classes work with different grades, not always staying with their own grade level in high school. We do look forward to redirecting additional federal resources towards helping schools make the safety improvements they need to have the confidence to be in for this semester and for next semester. And as one of the things that I think we've learned nationally and internationally about the pandemic is especially elementary schools are a lower risk vehicle for transmission than many other activities in society. Is it perfectly safe? Is anything perfectly safe? No, but it is reasonably safe. I have confidence in as a parent that my kids are in school. I hope that more, and many Coloradans have that. Many other Coloradans are hoping their kids get back soon, or they've been back and now they're out and they'll come back soon. So we hope that more Colorado school districts can do in person. We will be, there will be an extension of additional federal resources really in the next day or two that are announced that will help schools achieve that in-person learning. Final from the room.
You have said some other areas have these interventions and it worked well. Where are some of those places, or what are some examples?
We're happy to give you a review of I'll take another question because I don't have that in front of me, but we're happy to give you a review of some of that data from other places. Marianne? We should give Marianne a second.
You guys use a number of values to determine where on the color scale different counties are. So where will the new kind of trigger points be to go from orange to red and red to purple?
So I don't have that in front of me, and I don't know if it's on your handout, but essentially there were 3 ways that we looked at red. 2 of them are now red, and 1 is now this urgent, purple, which is literally hospitals overflowing. That's purple. Red is 2 metrics: cases per 100,000 and positivity rate. And I don't have that right in front of me, so I don't want to rat it off because I might not get it exactly right, but those should all be posted.
This is more of a question for the legislative leaders. We've already seen that half of the General Assembly, maybe not quite half, have a complete disregard for wearing masks, whether it's in committee hearings, walking around the building. If you're going to have a special session, is there anything you can do to require mask wearing, not only to protect each other, to protect their staff, to protect all of us who are down there? They just won't wear them.
Thanks, Marianne, and this is a really important question, and there's no doubt that making sure that we have the safest environment that we possibly can at the Capitol is one of our top priorities as we think through a special session in this pandemic. We are going to build off, just like Senator Garcia said, we're going to build off of the things that we learned from that COVID session. And I think you're going to see us following guidelines from health professionals, considering possibly testing regimens, making sure that people have access to the best high-quality masks that they possibly can, KN95s, which is more about protecting the person wearing them than worrying about whether or not people around you are wearing masks. I've also had very collaborative, good conversations with Republican leadership about the concerns that the public has and that staff have about people not wearing masks, and I remain encouraged that we can get to a place where people are, thinking about the community and thinking about each other and making sure that we have the safest possible environment that we can. But regardless, I think we're going to have stronger measures in place than we even did in the COVID session, which I think should instill confidence in staff and legislators as they come in to do the people's work.
I'll just quickly add to that the Senate did pass rules that require that, and with the exception of one specific member who had a disclosure qualification as to why that member could not wear a mask, the Senate regularly had no real challenges with this. So I have talked with Leader Holbert, and he has continued to echo his support for ensuring that the masks and social distancing and those parameters are used.
Thank you all for joining us. Thank you, our listeners.